Hello， 大家好，欢迎来到洛杉矶华人资讯网的直播现场，我是主播莉亚。随着年龄来到了40岁，大家感觉视力逐渐模糊，有的人需要佩戴一副乃至2副眼镜，一副老花镜，一副近视镜，真的非常麻烦。那这说明您的自然晶状体正在老化，产生了老花眼，甚至以后会有白内障的症状。那么如何一口气的解决老花眼、白内障再加近视眼呢？其实是有不少选择的，都能够让你永久的摆脱眼镜的困扰。今天我们很荣幸邀请到的是来自美国德州休斯顿的顶级眼科专家 Dr. Fred Mattioli， 他拥有22年的丰富从医经验，是休斯顿大学手术中心的资深专家，同时也是休斯顿排名第1名的诊所 Mattioli Vision Professionals by IQ Laser Vision 的创始人。那今天他将会与我们分享老花眼、近视眼以及白内障的治疗多个方式和方法。Hello, Dr. Mattioli. Thank you so much for joining us today.
It's always a pleasure. I hope everything's going great.
So today we're going to talk about vision correction procedures for people who are over 40 years old. I mean, people often wonder what to do if they have both presbyopia and myopia. I've heard about LASIK blend vision and refractive lens exchange as potential solutions. So what are they and how does it work?
Yeah, that's a great question. We see, as our population keeps getting older and older, these are definitely problems we've had in the past, but problems that are going to be even more important as we continue to age and we grow. Classify the treatments in 2 broad categories. First are surgeries that can be done on the outside of the eye, so on the cornea, like you mentioned, LASIK and laser vision correction. And then there's treatments that we can do inside the eye. So those 2 types of broad categories are the way to really think about what types of corrections can be done.
We can start with the surgery outside the eye. So with the blend vision, I heard that there is something like LASIK blend vision and the refractive lens exchange blend vision. So what is the blend vision? Like, how does it work?
Yeah, so the whole problem is the lens that's inside our eye. And that lens over time, typically after 40, like you mentioned, 40, 45, the lens doesn't flex as much as it used to. So now we can't, even if you see great far, we can't focus up close the way we used to. So what we need to do is, 1, refocus the light or replace the lens. And so in the younger group, early 40s, we tend to stay outside the eye and treat the focusing first. And so we do that with LASIK. Now, if you don't need glasses for distance, that's great. You can get LASIK and just have one eye treated for reading to see better up close. So that's what we call blended vision. It's where we have one eye that is focused for far vision and the other eye is focused more for intermediate or reading near vision. And that can be done with LASIK. If you already wear glasses to see far, then we can do LASIK on both eyes and just target one eye to see far and the other eye to see more up close. So the blended vision idea can also be applied to refractive lens exchange or permanent prescription lens replacement, as we call it. And that means that the lens inside the eye that's causing this presbyopia, the inability to see up close, is replaced. We can remove it, much like a cataract procedure, and then replace it with all kinds of different types of implants that I use, specialty high-end implants that are specific to each person. So sometimes there's better lens implants for you and then others that are better for your brother or sister. And so even between the eyes, sometimes I'll see one eye is a better lens replacement lens for far and the other one for near. So the idea of blended vision, we can apply to both laser vision correction and refractive lens exchange.
Got it. Are there any prescription limitation for blend vision procedure? I mean, if I have a very severe myopia, can it be blended with the other eye? Just curious.
Yeah, it's a great question. There are certain cases where we wouldn't want to do blended vision. That could be, for example, if one eye isn't correctable well, like people have what's called amblyopia, commonly known as lazy eye. So if one eye doesn't see well, even with glasses, then it's probably not the best idea to use a multifocal or a blended vision concept with that. The degree of prescription isn't generally a problem. It's more of how good does your eye see, with or without correction. So high myopes do really, really well with it because, they typically, we say they have like Coke bottle glasses. It's so thick And, it's heavy to wear. The prescription is so high, even with no correction, they basically can't function. So in blended vision, what we do is creating that distance eye fully corrected for all the high myopia or whatever prescription it is, including astigmatism. And the other eye, we leave just a little bit of near vision of myopia, nearsighted on purpose to help you see better up close.
Mm-hmm. Got it. So if we use monofocal lenses for blend vision, what lenses choices do we have?
Yeah, so monofocal is the only type of lens implant that we would use for blended vision. And monofocal just means one focus. And we can set that power to either far or near. The other type of lenses we use are called multifocal. They have, actually the lens has rings in it, different sizes. So it goes from small all the way up to larger rings, which helps you see without blended vision, far and near. The side effects tend to be more. And so I'm very selective on those types of patients that I would use a multifocal lens, because you can have side effects at night like glare and halos, which almost always will get better, but again, in a very select population. So monofocal, as opposed to multifocal, just has one focus power, and that's what we use for blended vision. So we can set the prescription far in one eye and near in the other. I think for me, what I found in the last year and a half, the most complete lens and most customizable lens is called the light adjustable lens.
Mm-hmm.
And this is the only type of lens in the world that exists where we can change the prescription while it's sitting inside the eye. So this is all done after the procedure. The procedure for all of these lenses, basically the same procedure. It's once we get the lens out, okay, what's going to be the best lens to put in? So the monofocal light adjustable lens for me has been the most fantastic lens because it's customizable after the procedure.
Speaking of LAL, the light adjustable lens, are there any process differences between light adjustable lens than the other lenses, the monofocal lenses?
Yes, there is. So even though the procedure is really identical, it's the same procedure as cataract surgery, the light adjustable lens is the only one that afterwards we can adjust the power. So we'll put the lenses in, calculate the powers needed, we aim for the distance, and then as we start to bring in the blended vision after the treatment, so usually a couple of weeks, 3 to 4 weeks after, we start shining a special UV light on the lens, which is obviously painless. There's no downtime, there's no recovery. We just have to shine the light right where we want to start bringing in the near vision. And there's usually a series of about 3 visits of what we call light adjustment. And that slowly brings the near vision in. So the beauty of this lay is that you tell us when to stop. Some people have very long arms. They like to read further out. Some people always, read very close. And so we can customize that over time to every patient's preference.
Yeah, I get it. People can have the peace of their mind because you know that you can adjust your power like after the surgery, because people are always wondering if I can get an accurate procedure. So it can definitely help people to relieve this kind of concerns. You probably have LAL surgery yourself. So how do you correct your vision, and why did you choose LAL as a surgeon?
Yeah, no, great question. And I thank you. I love talking about it because, yeah, I'm not only the surgeon that does it, but I'm also a patient. So in fact, 24 years ago, I had LASIK. So growing up, I had nearsightedness and astigmatism, and as soon as I could, I got LASIK done. So for 24 years, I never wore anything after my LASIK. Once I got a little bit older, then the presbyopia, the reading came in again, and so I now have blended vision. And so what I elected for was the light adjustable lens because of, as you said, the security, or at least the most flexibility that we have to get the best vision possible. So, and it was a year ago, it was last summer of 23 that I got my light adjustable lens done. I've had some treatments afterwards as expected, to tweak it and get it as sharp as possible. So I actually have blended vision. I have one eye for far and one eye that sees up close. So I'd never wear glasses now, but sometimes people still need, for example, I have an architect who's, doing blueprints, very small print, needs sometimes to have both eyes focused for that. So maybe 5% of the day he'll put on reading glasses. But for all practical purposes, I'm telling you, it's magical. It's unbelievable to be able to, see like I did before I needed glasses.
Yeah, that's really great to hear a real testimonial from a surgeon. I'm glad to hear that experience, and congratulations. And besides monofocal lenses, blunt vision, other refractive lens exchange procedures can also correct both presbyopia and myopia, like you just said, the multifocal lenses. I mean, how do multifocal lenses work? And you talk about it probably have some side effects. Why does it have side effects? Do we have to worry about that?
Yeah, great question. So multifocal lenses have actually been around for a very long time. Lens implant is more or less like a contact lens, a soft, flexible contact lens, and has a prescription on it. So what has been done with multifocal lenses, essentially, if you think of the contact lens, you'll have one power in the center, and then there will be a bigger ring around that, and then a bigger ring around that. And so you have what looks like several series of rings that have different focusing powers on them.
Like a camera lens.
That's why we call it multifocal as opposed to mono meaning one or single. Monofocal is just one lens, one power. And that's why I like the LAL, because if we need to, we can adjust that power to either the distance or the near or wherever we like it. Multifocal, once you put it in, it has that prescription on it, and that's what you get. And thankfully, the calculations are very, very accurate. And so we have fantastic results with multifocal lenses as well. But they're a little more finicky, a little more caution with that in patients. So depending on occupation, on health of the eye, and so we discuss all of those things. And then I have a criteria. It becomes fairly small for multifocal lenses. And if you're in that criteria, based on my experience in 24 years of operating, I'm comfortable with a multifocal lens. The downside of that is as you get out away from those data points that I like, I tend to see more side effects. And so some of those side effects are from the rings themselves. Because they're different powers, as your pupil gets larger, now more light is coming in on each of those rings. So that can produce like a halo effect, like a glare around the light. Almost everybody will see that right after surgery. And it tends to be around maybe, for a month or two or sometimes longer. But even with multifocal lenses, it's unusual that somebody will tell me they don't like it, they can't drive, it bothers them too much. Most of the time they're seeing great, and they just go, oh yeah, I noticed that this side effect of the halos. So what happens is probably over the next 6 months, the effect becomes less and less. So they're still very good lenses in the right patient.
Got it. It just depends on what you need. So our audience often asks at what age they should start considering RLE surgery, and what is your advice on this?
A lot of people, depending on their age, will qualify for 1, 2, or 3 different types of procedures. So that's one of the most important things to have a discussion with. Okay, well, what is it that you're looking for? What are your needs, and what are your needs in the future? So we try to plan all of that, individually for each patient. I think for lens implant surgery or refractive lens exchange, a permanent procedure, lens replacement, probably late 40s all the way up. So I would consider it, pretty much after about 47, 48 years old. Again, depending on the prescription, because sometimes we can use other treatments that will last a very long time, and then lens implants can be done. So I would think late 40s at the earliest. I think my youngest patient is probably about 42 for lens replacements. We do these procedures in about 15 minutes.
Got it. So it's a permanent solution. And what if someone's primary doctor says they probably is not a candidate for a certain kind of the surgery? Is it still worth it to come into the consultation?
Oh, absolutely. I can't tell. I've been doing this a long time now. I can't tell you how many times we've had patients come in that were told, they weren't candidates, or they should wait, or their prescription is changing, or they're too young. We've heard many, many different reasons why somebody wouldn't get their treatment when they wanted it. The issue becomes, what can I qualify for? Not, am I a candidate? Almost everybody's a candidate, but there's different things. So part of the issue that I've seen over the years is trying to keep up with technology. Most primary care doctors aren't aware of latest technology and techniques. A lot of primary care also don't have the equipment and the testing necessary to see if somebody's a candidate or not. We've come across so many different reasons, and why somebody may not be a candidate, and they turn out to be great candidates. And they're very happy. Most of them are just unhappy in that they didn't get it done sooner, but they're very happy that they came and checked it out. So absolutely, I'd recommend, everybody will do a consultation at no cost and just see if you're a candidate, and then you'll know for sure.
Got it. So another concern is the insurance coverage. What kind of the lenses does insurance typically cover?
Yeah, so insurance will not cover any refractive lens exchange, meaning you don't have a cataract yet. Insurance will start to cover part of the procedure once your vision has deteriorated enough to where, you really have been suffering for several years. And once they approve for you to have cataract surgery rather than you approving yourself for cataract surgery, they only cover the standard lenses. And what I mean by standard lenses, these are monofocal lenses that are not LAL. They're the light adjustable lenses is the most advanced technology that exists, and insurance doesn't cover any of those. So they will not cover LAL. They will not cover the multifocal lenses. They don't cover lenses that correct astigmatism, which almost everybody has. So it's a very basic, just distance lenses, and then they're very happy to cover your eyeglass prescription afterwards. But my job is to keep you out of eyeglasses, and if you're going to go through the surgery, we're going to do everything possible so that you don't have glasses afterwards, or as little as possible.
Got it. So you're probably going to lose your vision, like functional vision, for several years before you can get the insurance-covered lenses exchange. Is that right?
That's right. That's
Got
right.
it.
And you have to have a qualifying cataract. So just because you want it, or you're 60 and you're well into when we can do lens exchanges, if you don't have a cataract, they're still not going to cover it.
Got it. And also people curious about how much it would cost, considering the refractive lens exchange. So can you give us a clue, like how much it would start with?
Yeah, so there's a lot of variation on pricing because, regional differences depending on where you are, what part of the country. Certainly your surgeon skill level is a big factor. It's a very delicate procedure. And then the lenses themselves. Every vendor is going to have a different price for the cost of the lenses. The real benefit of this is that you are paying for something that is permanent and everlasting. So, in the long term, it's going to be something that you have made an investment in, and it's a one-time fee. Obviously, there's financing and these things that we offer that you can do. But the idea is that you're not repetitively paying for new contact lenses, new glasses, price ranges can vary considerably depending on where you are, who your surgeon is, and what lens implant you're needing. I would say probably anywhere between the $5,000 to $8,000 range per eye.
Got it. Thank you so much, Dr. Mattioli, for sharing your expertise with us today. It's been incredible, informative. Thank you so much.
My pleasure, Leah. Thank you so much. Great to see you.
Thank you. 如果有大家想要去了解到更多的这个有关于 Mattioli Vision Professional 的这个眼科手术的话，来，请导播老师放一下我们的信息板，大家都可以去扫描屏幕上方的二维码，或者是拨打电话713-776-3937 713-776-3937 ，call number 713-776-3937. If you have further questions or would you like to schedule a consultation with Dr. Mattioli? 或者是扫描屏幕上方的二维码。那如果你通过微信的方式来的话，$1000的这个立减的手术费是为所有人准备的，是所有的客户都可以有的。Thank you so much, and I'm gonna to see you next episode.
Thank you, Leah. Have a great day.
Bye bye.